Hi, I'm Dr. Bill Lyle, and I have a question for you. Are you a prepper? And I'm not talking about, are you stocking up on freeze-dried food? Are you stocking up on MREs? But are you and your organization using the next 5 weeks to prepare for the changes which are going to take place with the Biden-Harris administration come Inauguration Day? Because there are not just going to be big changes in the first year, not just during the first 100 days. There are going to be big changes taking place in the first 30 days. And we need to have a plan. We need to be prepared to respond, not to just see something that happens and then react. That is not effective. So we're going to tell you some of the things that you need to be prepared for. My specific area of concern is with God's preborn, the babies that we treat as patients within the womb. And there's several areas of concern. Number one, the Hyde Amendment. The Hyde Amendment has been in place for over 40 years, and it has restrictions on federal dollars, where federal dollars, primarily Medicaid, cannot go towards the paying of abortion services, either here in the United States or abroad. So I have concerns regarding this 40-year established amendment that it could be removed and federal dollars will be used to pay for abortions here, and we become a net exporter of abortions worldwide. Also, funding for Planned Parenthood. Planned Parenthood is the largest provider of abortions here in the United States, and I can see a dramatic increase in funding going to Planned Parenthood. Also, the abortion pill. The abortion pill is the fastest growing form of abortion in the United States. And we're not talking about the morning after pill where 3 days after somebody has intercourse. We are talking about 70 days after the first day of the last menstrual period. The abortion pill is 96 to 98% effective in killing the baby in the womb up to 10 weeks gestation. Well, certain drugs fall under what's called REMS restrictions, which is the risk evaluation and mitigation strategy of the FDA. Why? Because there are about 60 drugs of the 20,000 drugs approved by the FDA, which the FDA has serious concerns about their safety and implementation. So they put restrictions. Only certain physicians can use them. There's an increased amount of reporting and recording in order to use these medications. If the REMS restrictions are removed, you will see dramatic increase in the number of abortions being covered and being performed with the abortion pill known as mifepristone. But you're also going to see harm to patients because you will have any physician prescribing the abortion pill. You might even see the abortion pill being available mail order, just like so many other drugs are available mail order. So I'm really concerned about that as far as the availability of the abortion pill. Also, using the federal position of the president and the vice president to try to strike down abortion restrictions which are now in place in different states, such as parental consent, parental notification, gestational age of having an abortion performed in your state. And I can see that being a focus of this new Biden-Harris administration. We have never seen such a pro-abortion administration as what we are about to see come January 20th on Inauguration Day. So use these 5 weeks. Prepare and prep yourself and your organization with knowledge, experience, and with prayer so that we can respond and defend God's preborn. Because we were all created in the image of God. And when you're created in the image of God, you have to realize that abortion is an attack against God, and it's an attack against that image of God. We treat the preborn as patients. We give them blood transfusions, we can do heart surgery, we can do spine surgery while they are still in the womb. If they are a patient, they are a person. If they are a person, they deserve our protection. And that is going to be our duty, and that is going to be our role to defend God's preborn. So God bless you. If you have any questions, you can get a hold of me through my website, prolifedoc.org, and have a Merry Christmas.